Hi, good afternoon. How's everybody? I'm Dr. Leong Jern Lin from SN Ear, Nose, Throat Specialist Group, and very honored to be able to kick off this series of webinar that we are starting in conjunction with Menarini, Singapore. Very glad to be able to still continue to do some CMB activities in these times. And I hope everybody listening, we can share and learn a little bit of things from each other. And this is going to be a very short talk and exchange in terms of during these times, how this special situation has affected our day-to-day working environment. What are the things that we can look out for and should look out for, and what to emphasize on when it comes to taking care of our patients. Today's topic is to mask or not to mask. This is mainly to start the talking about upper respiratory tract infection. We're talking about sinus diseases, nasal problems, allergic rhinitis, sinusitis, and share a little bit of what's been going on in my practice over the last 3 months. Next. Okay, so it's been coming to 3 months already since we got to know about the first Wuhan virus. Now it's more appropriately known as the COVID-19. That's on January 23rd. 2 months ago, I don't think I would have thought things would have changed and progressed until this state today. But certainly on looking back, I guess I'm not surprised anymore. The only surprising thing is, well, we got to know that the virus not only can cause us health problems, but a big part of it this morning, if you have seen economic front and economic turmoil on the stock markets and stuff. And if you look at it, this is from this morning's papers. Yeah. So psychologically, it's causing a lot. And of course, psychologically, not only the whole world's involved now, really, I think all of us need to band together even more to get over this difficult time. Well, talking about psychologically, we are talking about people who, the moment they hear about the virus and things like that, well, something inside there just tells them they need to go and stock up the essential stuff in their daily, for their daily necessities. All right. So we have all these funny pictures of empty shelves of toilet rolls. People even put toilet rolls inside all these play machines. And imagine toilet paper roll 3,999. It comes with a free diamond, So things have changed so much that things that we take for granted has become a very important part of the change in what we should be getting used to. Well, you can see it from the funny part of life, or is this actually the sad part of life? It's up to you to decide. Well, mask. I don't think we'll ever have enough masks. To me, mask is very important. More so for the frontline workers, maybe be healthcare workers or the people, the taxi drivers or the people who need to meet different people, many people in their daily activities. Masks will never be enough, all right? But I certainly do hope out there everyone have sufficient enough to go through their clinic times, to go through seeing their patients. And of course, we see a very ingenious way of people using different things to make masks, including diapers, as well as, making 3-layered paper mache kind of masks that you can find on the YouTube and the internet. And I do hope over the next couple of months, even towards the end of the year or from now on, for our local patients at least, not to Dr. Hop as much as before. And this is mainly for not only their own health, but the health of our fellow general practitioners and family doctors. All right, this is very important to make sure that the spread of the disease doesn't really propagate to the healthcare workers, which to me is the most important part. All right, so the first time I ever took part in a webinar was a couple of weeks back, or 1 to 2 weeks back, on the COVID-19 Singapore experience. certainly found it useful. It was a quite a very comprehensive webinar. And with that, I thought it was a very novel way, and we decided that it may be the next best thing to do to keep the CMEs, the talks going, so that at least we are still keeping up in touch with what's happening out there, and as well as not only just reading journals, but listening into what's happening on certain topics that are very important to our daily practice. And from that, I don't know how many of you managed to log in, because it was only available to the first 1,000 attendees. So I was quite lucky to get in early. So to me, I zoomed in on a very important part of that talk was the aerosol generating procedures, because ENT is one of those specialized doctors that we actually do nasal endoscopies, we clean the nose and stuff, and that may be aerosolizing generating procedures. And because of that, yes, we may have to protect ourselves a little bit more, whether using PPEs, goggles, N95s. It depends on what we want to do, but certainly we are on the higher level of this. And then, of course, we do have to learn how to put on a mask and how to remove the mask and the various protective layers that we put ourselves on. And certainly, I understand and I feel it's really not easy to go through half a day even with the full PPE on. Extremely difficult. And these are the testing times that we actually sometimes have to ask, well, why we became doctors? This is one of the reasons. And with that, I just have to go through the day. So as you can see, ENT procedures is one of those procedures that may generate aerosol, and therefore may be easier to get the infection if we are not careful enough. So I think out there in the GP settings, nebulization, the dentists are the ones that are involved. The rest of it is mainly in the more specialized disciplines. So the topic I want to touch on, now a lot of people are sick, whether you have the COVID virus, the pneumonia, the upper respiratory tract, it's a viral infection. And we do have people out there with chronic illnesses. So we have to concentrate on how to help the people with chronic illness get by these difficult times. It doesn't mean that this virus period is when you do not have chronic illnesses. No, they are still there. You still need to take care of the patients. There are still cancer patients that we can take care of. All right. So today I'm going to share with you a small study that we have on allergic rhinitis and urticaria, which are common enough symptoms and that requires medication and better management, so that patients can better control this and not interfere with any additional infection that they may have, especially in this COVID-19 times. All right, so the global prevalence of allergy is 30% in the Asia Pacific region. Prevalence of allergic rhinitis can range from 2.5 to 44%. Because of the rapid urbanization and economic development, allergic diseases in the region is expected to rise over the next 2 decades. So what are the current guidelines when we talk about management of these illnesses? We're familiar with the ARIA guidelines. We're familiar with the EACI, the Galen World Allergic Organization guidelines. Basically, all of them tell us that H1 antihistamines are recommended as the first-line treatment, with the second generation antihistamine recommended over the first generation antihistamines. All right. So H1 is the second generation H1s are the kind of medication you want to treat the chronic illnesses. European studies, all right, indicated a disparity in guidelines adherence among the different healthcare providers. So does it mean that you have a guideline, a lot of people will follow it? Well, that's not true. So the guidelines are used in some of the Asia Pacific countries where country-specific guidelines do not exist. Right? So not every country have their own guidelines. So the study aims, this study gathered 10 experts from the Asia Pacific region, surveyed on the awareness of